Good morning, everyone. It's 30 past 11, so I propose to start this August Tuesday Connect. So first of all, I hope you had a relaxing break, summer break, and that you are ready to get back to work. And to kick off the September season, today we will have an interesting presentation from EU-JAMRAI Work Package 7. Let me introduce Silvana and Paolo, who will talk today a bit about the work they are doing in the work package 7, so the work package on IPC, in the human part, and they will talk about a survey they made to design an IPC digital tool. So I'm gonna stop sharing. Silvana, if you want to share.
Can you hear me well?
Perfectly.
Okay,
The floor is
perfect.
yours.
So, first of all, thank you so much to be connected today. I'm connecting from this sunny Italy, actually. And we are going to discuss about IPC Digital Tool Survey and what we found from the survey implementation. So, okay. The aim of the survey was the aim of the meeting is to present the IPC Digital Tools Survey and to introduce the WUPI 7.1 main achievements of this last year. The target of this survey, it was essentially IPC professional across European countries. An invitation was circulated through the EU-JAMRAI partner network, and we encouraged the participation from a broader range of national IPC stakeholders, but also we received some, let's say, response from facility managers. The IPC Digital Tool Survey aim to map existing IPC digital tools and to capture perception of tool effectiveness. This was an important part of our survey. And also to identify unmet needs and desired functionalities, but also, and most of all, to gauge interest in cross-national collaboration and participation in designing a working group for IPC digital resources. So essentially what we asked for, innovative or less known tools in their country region and to classify them by type. We ranked the tools among the more frequent like guidelines, poster, software applications, digital platform, policies and programs. But also the unusual one, like, for example, dashboard and embedded electronic health record modules or automated feedback tools. We're going to see in deeper next slides. The survey was created on the European Commission EU survey platform. And we wanted to be from, let's say, from a privacy point of view, we wanted to be sure that the survey was safe. The survey was represented in 4 main sections, like general information, existing tools and resources, challenges and implementation context, and then needs and future platform design. The period was essentially in which the survey was open from the 7th of April to the end of May 2025. The dissemination of the survey result will be shared on EU-JAMRAI with EU-JAMRAI partners. Essentially, the report will be uploaded in JARIME to Teams workspace for full access. And also Insight will guide the design of our Insight platform and also presented in the upcoming Rome workshop discussion that will happen in March 2026. So, a snapshot of the survey. The respondents were 23 professionals across 16 European countries, so broad geographic distribution, but very low responding rate. IPC roles, essentially almost half national IPC focal point, but also 30% facility level IPC focal point. So leadership or coordination role engagement was quite high, but there was also a representation of frontline operational partners. Willing to join a JAMRAI 2 working group? Yes. Almost all of them, 18 over 23, were expressing the desire to participate to our working group for the design of Insight platform. Who had already a digital IPC platform at national level, only 9 respondents, so essentially 1/3 of the total ones. So 4 on they have a facility level platform, 4 in development. So essentially the digital IPC ecosystem is quite fragmented. Tools submitted were 25 unique IPC tools, so a lot of different tools has been collected. We are going to deep dive on that later. But the main effectiveness score, it was 3.3 over 5. So the respondents essentially perceived their tool as moderately effective. So most common IPC tool types, essentially we are still running in the old ones. For example, a guideline and report were the most represented, poster and infographic the second place, and then software, apps and platform represented the 17.4%. So essentially what we can say that most common tools are aligned with traditional IPC strategies. And also they, as we can see later, they will correlate with the effectiveness that is moderate. So this finding, this correlation, can suggest that static tools may no longer meet operational needs. We're going to discuss this later. So IPC tool types, example that were represented, hospital are hospital specific dashboard for monitoring infection trends, then also embedded clinical record modules, health acquired infection reporting system. This one is a part that is really pushing a lot on the new tools on the international panorama. Automated feedback tools also that alert teams based on IPC incidents or resistant partners. So this is some example of the tools that were represented by respondents. Tool categories highlighted, again, old style national guideline, but also AI surveillance. That is very interesting because AI surveillance is very prone to be interrelated with electronic health records, but also with automated, let's say, automated systems, but also very close to artificial intelligence, especially machine learning. Training programs also were tool categories that were represented and highlighted by the respondents. So essentially, surveillance and training are, let's say, growing priorities because the two fields are very easily integrated with digital technologies. Core IPC elements covered. There was another, let's say, question asked to the respondents. And even here, the respondents were aligning with the with the more represented trends in the digital panorama because the response were hand hygiene, so almost 70% are using digital technology for hand hygiene. almost 35% reporting and surveillance, but also surprisingly, PPE, the 26%. In some studies, we can also find PPE that are englobated with the digital technology and artificial intelligence. There are already some studies and pilot studies on that. Anyway, so it was also represented in our survey. Core IPC elements covered. Essentially, here we were a little bit surprised because the limited, the main representation of
che vogliamo fare a Madrid.
The main representation of core element present in a digital solution were maximum one or two core elements represented. So it means that when we have for example, a complicated and complex environment, like, for example, long-term care facility that require integrated multi-element IPC strategy, these technologies may be not effective, not yet, essentially. Gap identified, that is something that from pilot studies around the world is they are trying to find a gap, to fill the gap, are environmental cleaning, staff vaccination, or air quality. So despite their relevance in multi-drug resistant and environmental control of the hospitals, those topics are still under represented. Top barriers to IPC implementation, okay. As usual, funding shortage, so almost 60%. But also, that is very, pretty much important, lack of trained personnel, but also poor protocol adherence. So the first two, funding shortage and lack of trained personnel, are very important because essentially when most of all because digital technologies and artificial intelligence sometimes have some kind of reluctancy from first line operators. The lack of training and funding shortages can be really a huge barrier to implementation. So essentially, digital solution must be paired with system-wide investment in IPC capacity, both supply economically, but also training. So also many countries were reporting this lack of training. So and the lack of training can also cause low engagement to the project. So essentially is a point to reflect on. Other top barrier are fragmented data. So IPC data is scattered across unlinked systems. Even here, again, interoperability is still a barrier. There is also a low priority of IPC, often if we compare to other area subjected to financial demands. But also it can be weak leadership support. And these 2 points are really important to implement in the future these kind of technologies. Most IPC challenges represented in the survey, again, we mentioned it before, but here is very clear, 60% of the respondents replied that long-term care facility are a challenge. But also primary care and hospitals, primary care and let's say outpatient in hospitals is almost 35%. So essentially future tools, digital tools must go beyond the hospital and support community-based IPC. That is quite in trend with the panorama, European, but also worldwide panorama. Most needed IPC support tool. This is important because that was the core of our survey. So essentially, the IPC support tool required seems to be digital compliance monitoring, for example, or best practice platform and training. Again, training here is represented, but also dashboard, mentorship, and checklist. So essentially, respondents rate existing tool as less effective more often, and they are requiring real-time features and benchmarking, implying that readiness for digital transition is aligned with operational need. Essentially, in summary, demand is shifting toward digital solution, but only if they are actionable, real-time, and shareable solution. And this one can be a problem, not for digital technologies per se, but for artificial intelligence, it may be a big problem. So top requested platform features, data visualization and self-assessment were the main feature requested. But this is quite clear. I mean, we need to understand the technology, and data visualization is the first point to be considered from the frontline users. Access to guideline and mobile usability also was quite well represented. So what we can summarize from this, that class demands of characteristics of features cluster around modular, interactive, but also mobile-ready platform. So not comprehensive static repository as was happening in the past, but we are going toward new systems that can be modular, but always agile. Let's say, this part was really represented very clearly. So if I can summarize all these findings, we can say that static tools still dominate, even if they were they are already considered like digital technologies, but they are still really focusing on static tools like representational guideline, posters, and these kind of things. And also the correlation needs are representing still a effectiveness and engagement that is lower than expected. But we are going toward the real-time and dynamic tools. So the real need is this one. Tools represented are still focusing on only one or two IPC areas. Long-term care facility need broader or complex situations, reality. They may need broader IPC strategies. So when we will design tools, digitalization and artificial intelligence need to run toward bundle IPC components. Still, the training infrastructure is weak, so workforce and compliance issue need to be addressed even before to start the implementation. And we need to include embedded training and peer learning. From our small survey, we can understand that still there is a low representation of national platforms, because only 9 over 23 respondents were representing national platform, and also the tools are fragmented. So the the platform design implication is that we need to ensure mobile access, but also national platform that can be also represented at local level. We have model tool scores. So essentially, effectiveness, as we mentioned before, is quite not satisfactory. There is a high demand for benchmarking, but also tool that can provide feedback on their potentiality. So we need to prioritize essentially for platform design, dashboard, but clear dashboard that can be really user-friendly, but also self-assessment tools. This was a finding that was very clear from the respondents. Survey limitation, we had many for sure. And so essentially, despite it was stated clearly what we meant about digitalization, digital tool, and artificial intelligence, there were a different interpretation of the concept of digital tool. We had a limited response rate of the survey, only 23, despite the survey was disseminated very broadly. Many tools are adopted only locally, so it's difficult to capture the real nature of the tool. Several questions relied on self-reportment assessment, so it's difficult also to interpret the data. Limited comparability of tools and potentially underrepresenting their practical value. So essentially, every single tool represented needed more investigations. So at this point, I will leave the floor to also to our colleagues. Essentially, we are going to introduce the last achievement for WP7. First of all, I don't know, Paolo, are you connected?
Yes, sure.
Do you want to introduce his achievement or shall I go ahead?
Please go ahead.
Okay, so essentially, this is the representation of the last year highlights. This is the Istituto Superiore Sanità achievement in subtask 1, 2, 3, 4, and 8. So essentially, in May 25, as you know, we launched we closed the survey, and we are introducing the result today. We start the following also the survey result. We start the inside digital platform work. We finalized the blueprint early 2025, and also we did the first kickoff meeting, and we created the working group the 16th of June. And also we finalized the pilot project report repository in June 2025. At the moment, we have 10 country initiatives, and we will have also in the winter, we will have two pilot project represented always in Tuesday Connect. Also, the workshop in Barcelona was used to introduce the IPC pilot design, but also brainstorming on IPC digital platform and required features. We are planning already the Rome workshop, and you are invited, all of you. Training and insight platform presentation, self-evaluation tool and tools and pilot champions will be represented in this event. And now I leave the floor to my colleagues for sorry. The Insight platform is the last slide from our side. So Insight, what will be will be a central hub for IPC tool and resources. We introduced also the report, essentially the project through the teams in JAMRAI 2. It will be interactive, so there will be the place to do to run self-assessment through user-friendly dashboard, but also benchmarking, because the result will be represented in a way that can be aggregated across local, let's say, facility level, but also regional and national level. will be adaptable for hospital, but also for long-term care facility and community care. And also the access will be secure, so it will be GDPR compliant. We will try to develop the tool multilingual, as many colleagues and partners request, and we will try to develop also in a way that is mobile friendly. So essentially the goal is to create a European digital platform to strengthen IPC through shared, aggregated, and innovative solutions. And now I really leave the floor to Iko. Thank you so much for listening.
Hi, can you hear me well? Yeah, perfect. Thank you, Silvana, for lending us. Oh,
yes, wait, 1 second. I'm just...
Okay. Thank you. Good morning, everyone. I am María López in representation of ECO. We in ECO are co-leaders of the Work Packet 7, as you may know, which focuses in IPC activities. And we are also, alongside with ISS and SSI, task leaders of the 7.1, which addresses IPC in human actions. During our first period in this project, our focus was on establishing the operational framework and strategic objectives of the whole project. To this end, and as Silvana stated in the previous slide, the first face-to-face meeting for Work Packet 7.1 was held in Barcelona, which with 65 partners from 22 countries in attendance. Here you can see a picture of everyone. During this meeting, among a lot of objectives and explanations of important stakeholders, we established a common plan and a strategy for IPC in human actions activities for the coming years, following, as always, a One Health approach. And additionally, ECO began planning activities and the future organization for the tasks under our responsibility. In 2025, we worked alongside with ECDC in elaboration a document of recommendation in diagnostic stewardship in blood cultures, which is a key tool in diagnosis of bacteremia, as you also know. And this document involved experts from 12 countries and was submitted in May this year, and will serve in the elaboration of the ECDC official guidelines and documents. We are currently now working with the CDC as well in reviewing ECDC's directory and of international and national IPC guidelines. And we're also working in a task of mapping case definitions for healthcare-associated infections in national surveillance systems across Europe. And we are also, for the record, preparing activities with WHO related to IPC in long-term care facilities. And that's for the ECO part. Thank you very much.
Yes, hello everybody. Can you hear me? Yes,
Perfectly.
María is nodding. Yes. Okay, I'm Asja Kunøe, representing Statens Serum Institute, Copenhagen, Denmark, and we are together with ECO, Work Packets lead of Work Packet 7. And also SSI has been asked to short say something about our achievements so far. And the first dot is just to inform you that we have established an advisory board for selected 7.1 outcomes together with ECO and ISS. And that's because we are all working together with WHO and ECDC and some of us also UKIC. And so we thought that it would be a nice way to ensure the alignment of our outputs and recommendations to have this advisory board helping us to give comments of some of our preliminary versions of our outputs along the way. So one of our concrete 7.1 tasks is to work on an EU framework for IPC to support the implementation of core competences. So we started out with a survey to the 7.1 partners to review the current IPC competencies recommendations, the ECDC 2013 technical document, and we are just about to finalize a report with the evaluations of how the partners in the countries use this document and what is missing to use it for future actions. And we are working close together with ECDC and also going to decide with them whether we should make some kind of practical implementation roadmap, or we're going to help them out to update the ECDC 2013 document, but that's not decided yet. Another 7.1.1 subtask is to develop the self-assessment system, which is a system to assess the degree of competences in the healthcare facilities. And there has been established a working group where they are quite far in developing the pilot version for the SAS at junior and senior level. So we aim at going to pilot test this SAS system during the autumn or around the new year. And before starting the development of the SAS system, also we carried out a survey to figure out how SAS was used in the European region. And we also work close together with WHO on this assessment system. And then one of the activities in 7.1.3 is to take care of a peer-to-peer program where we are working closely together with UKIC, the European Committee for Infection Prevention and Control, a working group under ESCMID. And we are quite far in having some more concrete actions ready to start up the mentorship activities. But we have already started to carry out some of the webinars. I guess that some of you have already participated in, where we have 4 quarterly webinars each year. And then lastly, we also during the last years have spent some time on having one-to-one meetings with all our 7.1 partners. And we have quite a few of them around, I think it's around 55 meetings we're going to carry out. So that's also a part of our achievements. And we are carrying out these one-to-one meetings together with the ECO and ISS. So I think that's very brief what we have been working on so far.
So thank you so much, Work Package 7 team, and congratulations for the huge work performed during this first reporting period. I think it's a really good example of how to share responsibility between different entities, and also a huge and important example of collaboration with stakeholders. As you've shown, you are closely working with ECDC and WHO. And it also shows well what JAMRAI can provide, tools, also supporting European guidelines, but also doing some training. So yeah, congratulations for the hard work. And I will open the floor to questions. So if you have questions in the audience, feel free to raise your hand or intervene or write comments in the chat. Don't be shy. Yes, Diamantis.
Yes, hello. Thank you so much, Silvana, María, and Asja, not only for today's presentation, but also for all the work you've done. And already, as you mentioned, we have been working closely together, and thank you for the nice results. I have only, a few questions. First of all, for Silvana, I was wondering what components you plan to include in Insight, and whether you have decided, or are you still in a process of discussing this? What components of IPC will be integrated in Insight? For María, thank you so much for sharing the diagnostic stewardship report. I think it was very, very useful for us. I think it helped us a bit with drafting the EU guidelines to make sure that we include diagnostic stewardship there. I was wondering whether you plan to publish it as well, because I think it will also be very useful for other stakeholders, not only for ECDC. I think it's a very nice document, and it's time that diagnostic stewardship is, is really brought forward. And Asja, thank you very much for also sharing the draft report on the core competencies for 2013. I mean, we as we said, it's not yet decided whether this document of 2013 will be updated. I think it will be a substantial task. But I think it's important that we consider this. So thank you again.
Silvana, do you want to?
Yes, I leave the floor to Paolo.
Yeah.
I think he wants to
Good morning, everybody. Thank you, Diamantis, for your question. Regarding insight, as you know, the main component, the main part will be to use the IPCAF survey. But following your suggestion, we would like to use also some indicators from the from the point prevalence survey, in particular the indicators that are specific for the units, not for the hospitals, but for the units, applied to the entire hospital. In this way, we could have also some indicators about the status. But we are still in the process of consulting our software developer to understand how to organize. And then before to implement the first version of the list of questions, we would organize another meeting to be sure that we are not forgetting any important supplementary indicator. So we will use what is in the PPS, but for units instead than hospital. Over.
Perfect. Regarding the question, Diamantis, thank you very much for your question and for your support during this task. And yes, the answer is yes. We want to publish our results in a journal, in a scientific journal. We will start working on it in September once everyone's back. But yes, our intention is to make the results public. And Asja?
I think I have no comments. It's fine. Thank you.
Any other question from the audience? No question yet. I have one regarding the response rate. So you mentioned it was a bit low. Now that you have some results to share, could it be a way to motivate new respondents to participate? Especially, I don't know, maybe it could be interesting also to have a better understanding of which type of country participated in the survey, to try to also have different settings, as you mentioned, different countries participating. So maybe motivating respondents through the first results you have Would it be something applicable to have a second round of survey or something like that?
At the moment, I would say no, because we are still considering what can be the structure of our digital platform, and the tools were representing more or less very well the European panorama. Is not there is not a cluster on, for example, North Europe, or is quite representative. But I know, I'm not sure. I don't know. Maybe Paolo think in a different way. I don't know. But for the moment, I don't see the need to repeat maybe later. Maybe later. I don't know, Paolo. What do you think?
I want to. I don't think that there is a problem of response rate. I think it's the problem of dissemination locally in each member state, because most of the participants of JAMRAI doesn't have a perfect knowledge of what is happening locally, and most of these new innovative tools or solutions are at the local level. So yes, as Silvana said, in the future we could try to use a different approach, pushing more, for instance, with the liaison with the persons that are in charge to connect with the Ministry of Health, and try to see through them if it is possible to obtain other information, other news about innovative tools. But as Silvana said, we think that at least we have this very important interest in the new use of artificial intelligence, with needs of tools for training. So we know where to work. But in the future, we will reconsider to repeat the survey, to extend.
Yeah, also because just to complete what Paolo was saying, there will be in the Insight platform development will be a phase of pilot testing. There will be not a survey, but for sure a first step on a real validation of the platform. So we prefer to concentrate our effort rather on that. To repeat a survey that, yes, is already giving us the answer that we needed.
No, I think it's a good strategy, especially since we have been multiplying surveys with JAMRAI. We counted them for the reporting, and I think we issued like 16 surveys since the beginning of the JAMRAI, so it's quite a lot. So obviously countries and people might be a bit tired of surveys, so I agree that pilot testing and feedback directly on the pilot on something concrete is more insightful. So yeah. Any other question? More questions. So feel free also to send questions directly to Silvana, Paolo, or ourselves, the coordination team, and we can forward the answer to ISS team and Work Package 7 team. And if we don't have any more questions, maybe I can just introduce the next Tuesday Connect. That will be up. Let me just share my screen. That will be in September. So next Tuesday Connect gonna be in September 16, and it's gonna be a different presentation, this time on innovation. with contribution from stakeholders, because as you know, we also value input from stakeholders. And on September, GARDP and Carbix will do a joint presentation on their work to ensure access to innovation and antibiotics. So we are looking forward to this presentation. And well, in the meantime, if you have any question or if you want to apply for Tuesday Connect, feel free to contact us. And finally, I would also like to congratulate you for the work done this summer on the reporting. It has been a busy period for the project. And we have a lot of interesting results to share already. And you also will dedicate a lot of time to reporting financing information. So thank you for that. We probably won't be able to submit in time at the end of August for different reasons. But well, a lot of partners already finished their contribution. So this is already a huge achievement. So thank you all. And I look forward to seeing you in September.